evening to all of you. I'm Sayukta from Beautiful Spotless Insta Live, and here we are going to discuss a very important topic, which is acne management. As we all know, acne is quite a common chronic skin condition, and those who are prone to acne or have oily skin, or those who have just of us have gone through it, so we understand how difficult it is to cope with it. I often say acne is just not about the appearance. It's just not a surface related issue. Deep down, it also affects our mental health. Many times people go in depression because they don't know how to deal with this. Appearance, of course, plays a very important role in forming our, personality. So, of course, acne management is a very important topic, and that's the topic today we are going to deal with. And our skin expert of this Insta Live is Dr. Bansari Davda, who is a renowned skin expert from Chennai. She is going to join us shortly. So, Dr. Bansari is a distinguished consultant dermatologist and cosmetologist with a comprehensive background in both academic and practical dermatology. Now, she has earned her MBBS from Pramukhaswamy Medical College, followed by a postgraduate degree in dermatology, venereology, and leprosy from Vinayaka Missions Medical College, where she graduated as a silver medalist. Her commitment to advancing her expertise is evident from her international training, including a prestigious fellowship in aesthetic and anti-aging medicine from Germany, and specialized courses in hair transplant surgery and aesthetic medicine. And currently, Dr. Bansari is practicing at Finis Aesthetics in Chennai. A very warm welcome to you, Doctor.
Thank you. Thank you for having me.
It's such a pleasure, Doctor, to have you with us. And the topic that we are going to delve into today is so important, acne management. Most of us have gone through that phase of acne vulgaris, especially those who have oily skin or acne-prone skin. They know how important or how difficult, rather, it is to deal with acne. So it's just not something which is only related with our appearance. Deep down, it also affects our mental health. So it becomes even more important to understand the proper management. To start with, Doctor, what is acne? How it is formed?
So acne is a multifactorial disorder, but the main pathology is that it's a disorder of pilosebaceous unit. So hair follicle connected with a oil gland, it gets blocked in the acne, and then it results in acne. So there are multiple factors which can cause acne, like hormonal changes, stress, excessive sugar intake. So that we will come to later. But yeah, blockage of a hair follicular duct, the pilosebaceous duct, is what is the cause of acne.
Doctor, as layman, many times we see these small bumps with white heads or black heads. That's what we normally call them. Then some of the acnes are really big, pus-filled. Some are very painful, and many a times at a later stage, they looks like cystic, like a big cyst. So, what are the various grades or types of acne, doctor?
Okay, so there are four types of acne. The grade one is the milder version, the what we call blackheads and whiteheads. So that's grade one.
Mm-hmm.
Then going to grade two, it will have blackheads and whiteheads, but some papules along with it, the red colored little bumps. Then third
Yes.
grade will have more of pustules, the pus-filled big pimples. And the fourth grade will be proper nodular cystic acne. It will be filled with big pus-filled nodules and cysts. So there are four grades ranging from mild, moderate, moderately severe to severe.
Okay, doctor. Now, we also see patterns. Many times we see these small bumps on our forehead or in the butterfly area, the cheek, nose, we'll see these pimples. Or else, many times we see along the jawline. Do they symbolize something?
Yeah, so see, not every time, not necessarily that every time, but yeah, most of the times you can try and figure out what is the reason of your acne. If it's along the jawline and chin area, it could be hormonal. It could be due to PCOS, thyroid, or any hormonal imbalance going on in your body. And if it's forehead acne, it could be due to any hair oils you are using, hair wax, hair gel, or it's something related to the scalp pathology. So yeah, sometimes they do indicate the factors, but not every time, but yeah, most of the times.
Fair enough.
Yeah.
Doctor, we as Indians are so obsessed with home remedies. So whatever happens, especially with our skin, we'll first run inside our kitchen and try to apply something. Dadi ka nuska, nani ka nuska. We love, applying things on our face. And when it comes to pimple, we have seen people applying toothpaste, garlic, lemon juice, turmeric, basin, multani mitti. They are anyways very common. Curd. My question to you is, do these home remedies work in case of acne or they can worsen the situation?
No, they don't work for acne, and I definitely believe they worsen the situation most of the times. See, this lemon and tomato and all, curd, everything has a certain amount of acid, and it's better
Hmm.
in as ingested. Eat your fruits, don't apply your fruits. Eat your stuff, don't
Hmm.
apply it. I believe in that because they don't have the significant amount or percentage which is needed to make a difference to the skin, and in turn it can cause harm and it can be harsh for the skin. So better to go to a dermatologist and determine what your skin needs rather than doing home remedies.
Hmm. Apart from home remedies, another thing we are obsessed with is going to a nearby chemist shop, get a topical application over the counter, and start applying it. And initially, we fall for it, because initially they work like a magic cream. So
Yeah.
we feel that we have saved on the consultation fees of a doctor, we have saved the appointment time, etc., etc., and now we have this magical cream in our hands. But later on, we realize is that our skin is getting, addicted to that tube. So, what's your take? What's your advice on using over-the-counter topical application or medication? How bad they can be?
So, see, I would never suggest that directly without consulting your doctor, you buy any OTC products. Some OTC products might be nice, but consult your dermatologist. Ask them if you need it, if it's good for you, and if it's suitable for your skin. Then only you should go for it. Otherwise, I would never recommend to buy by yourself an OTC product. Consult a dermatologist, then you can get an OTC product.
Hmm. Now, for example, a person is, getting acne, initial stages maybe, and he or she go and consult a qualified dermat like you. Then there is a person who has tried almost everything, gone by what social media influencers have told them, DIYs, or these over-the-counter medication. Now, when these two types of people come to you, one who is a very fresh case of acne, second who has tried everything probably and then landed in front of a doctor, um, do they differ their treatment length? Is it different for both of them?
Yeah, so if people have tried lot of things due to the DIYs and social media, sometimes their acne are worse. So they do take a longer time to treat rather than the people who have never gotten treated first. So yeah,
Hmm.
it sometimes it's so much worse. Like so many people come with barrier damage due to using retinoids and tretinoin, without any kind of instruction. They don't know how much to use, they don't know how often to use, they don't know what it should be combined it with and not should be combined with. So they come with barrier damage with a face full of acne. Previously they never used to have acne, now they have full face of acne. So it takes a lot of time to repair that skin barrier damage.
Right. So it's always a good idea to go and check with your doctor, a qualified dermatologist, in case you have acne. So as soon as you go, land up in front of a doctor, it's more easy to take care of your
Yeah.
skin-related issues. Now, because we were talking about these DIYs, etc. And there are so many influencers on various social media platforms, and skin-related issues are probably their favorite topic. Not most of them are qualified dermats, very few maybe. But then they yesterday only I was watching a reel where they were telling us to do chemical peels at home, and they were emphasizing the fact that how easy it is to do chemical peels at home. Before that, we were just struggling with the beauty parlor aunties to because they also claim to be doing these chemical peels at home. So again, with these procedures, with these actives, retinols or various actives were not so easily known by laymen or people before. But now
Yeah.
almost everyone knows about these actives, chemical peels, and they are trying them by themselves over the counter. So again, how bad they can be.
So yeah, that also similarly it would be very extremely bad, I would say. Peels at home not at all advised. um, Peels are higher strength of what OTC products are. Like OTC products still have lesser concentration, so maybe a lesser chance of damage, but peels are much higher concentrated concentration and much higher risk of side effects if you do it at home. And you definitely shouldn't do it at home or even with any quacks. Always you should go to a dermatologist and get it done.
Right. So with procedures, with treatment, please trust your doctor. Please go to a qualified dermat and trust your doctor. Follow the prescriptions. That's equally
Yeah.
important. Now, after talking about the skincare regimen, we all know that skincare is important. A good skincare routine is what you need to make a good skin barrier. But then again, there are so many, skincare routines trending these days, starting from Korean skincare regime to 10 step, 7-step skincare regime. Practically, it's not possible to follow a 7-step skincare regime on a routine basis. And we need to be more consistent with our skincare regime if you want to make a good skin barrier. So, what could be a very basic, practical, minimalistic skincare regimen that we can go with, especially in case of acne?
Yeah, so I never advise 7 step, 10 step regimen to any of my clients, and I actually advise them to stop using multiple actives. For me, the most important steps are 3 steps. I would suggest it to all my clients, be it a 1-year-old child to a 100-year-old adult. 3 steps are face wash, moisturizer, sunscreen. These 3 things are must. If that's what you do, it's more than enough.
So face wash, moisturizer, and sunscreen.
This
Now with face wash, again, people because mostly people who have oily skin are more prone to acne, and they feel that it's because of the dust or the excessive oil that they are getting these acne, and they'll keep on washing their face with a face wash again and again, a number of times, feeling that the more
more times they
this way
wash, the
they'll
cleaner it will be. Yeah, so that's one of the biggest myths. It's not like that. If you wash it more times,
hmm.
your skin barrier will be more damaged and it might lead to more breakouts. So twice a day is more than enough to wash your face with face wash.
And what kind of cleanser to go for in case they have a acne
So
prone skin?
I would suggest a salicylic based cleanser that would work the best for acne prone oily skin type.
Fair enough. Again, with moisturizer, people will say that, I'm already secreting so much of sebum, or probably that is one of the reasons people who have oily skin, they avoid or skip this part of moisturizer. They feel it's not required for them. But as you mentioned, and emphasis that, a face wash, moisturizer, sunscreen, very important. Why and what kind of moisturizer we should go for them?
So see, people, yes, till now, till date, even though we try to spread awareness via social media, but still lot of people it has not reached yet. Still, a lot of people think that oily skin and acne-prone skin should not use moisturizer, but that is not true. They have to use at least a lightweight moisturizer, a gel-based moisturizer, which can nourish their skin. Because sometimes when skin is dehydrated, the skin doesn't have enough moisture, it can produce more acne, more oil and more acne. So it's necessary to nourish your skin with at least a lightweight gel based moisturizer.
Right. So moisturizer again is very important. And now coming to the third part, most important part, sunscreen. Now I will leave aside the people who have acne prone skin. None of us, most of us don't use sunscreen on a regular basis. We feel that sunscreen is something that we need to use only when we go out, step under the sun. And people who have acne, they feel that sunscreen will make them sweat a lot. Sunscreen will make their face more patchy, and they are so reluctant in using it, saying that we don't want to layer up our acne with sunscreens. So why sunscreens are so important, and again, what kind of sunscreen to go for?
See, sunscreen is very important for everyone. Similarly, like moisturizer, you just have to find the right kind of sunscreen to suit your skin. It should be non-comedogenic, non-irritant, lightweight, gel-based, and you should apply it at least once a day, even if you're indoors, because the blue light from laptop, phones can irritate you. And if you are near the big windows, the sunlight is still pouring in. So even if you are at the house at least once a day in the morning, I would suggest sunscreen ideally.
Right, so sunscreens are very important. Please do not skip it. Even if you are indoor working from home, housemaker, etc., please apply it at least once. Now, with sunscreens, doctor, when we go out to buy a sunscreen, there are so many information written on the box or the tube containing sunscreens, starting from SPF to good star rating to PA factors, etc., etc. So, what are the basics that we should look for?
So see, the sunscreen ideally SPF 30 or above in India, and PA 3 plus to 4 plus is a minimum requirement. And for acne oily skin, I would suggest you read the label and see non-comedogenic, non-greasy, non-oily, non-irritant. Any kind of this labels are necessary that shows that it doesn't have ingredients which can cause you more acne.
Right. So these are the things to look for. And in case you have doubt, you are confused regarding your face wash, your moisturizer, your sunscreen, please go and take advice from a qualified dermat. Talk to your doctor. They'll help you in finding the right product as per your skin type, as per your skin condition. Don't fall for the market gimmick. Market is flooded with products. Another trend these days is of experimenting a lot with your face skincare products. Like we'll end up buying like 50 bottles in the name of
Yeah.
skincare regime. Won't follow, of course. And in another 2 months, and this frenzy of customized products for you is again what people are falling for. Is experimenting with our product a good thing, doctor?
No, I would not tell it is. See, if initially in the initial period you want to see, you buy something and it's not suiting you, then you can change that and see what is suiting you. But after some products have started suiting you, your skin is not reacting badly at all. In fact, it's turning out to be more supple and healthy and beautiful. Then don't keep on changing products. Then don't keep on experimenting. Then stick to that product.
Right.
Yeah.
And now we also hear so much about, that acne is one thing, treating acne is one thing, and treating post-acne pigmentary marks and scars, they look like the bigger challenge. Especially with these teenagers and young adolescents, when they attain puberty, they get these acne vulgaries. And when they go and talk to their parents, probably they'll say that it's a very natural thing. It is natural, definitely. You are growing, so it's a sign of it, which is a good thing. But then the parents often say that you don't need to go and consult a doctor because it's a natural thing, it will happen. But later on we have seen that acne eventually goes, it's okay. But then the marks, the scars, the pits they leave, they look like they are forever, ever and ever.
Yes.
So how important it is, doctor, to get the acne treated at times so that we can save on these marks and scars?
Yes, it's definitely very important to start getting treatment for acne as soon as possible. It's very important to determine the cause of your acne first. So visit your dermatologist and get it treated. Don't be like, no, it is normal, it will come, it will go on its own. Yes, all of that is true. It might go on its own, but you never know, it might not go also. So it's better to visit a dermat rather than live with scars and marks, which are not 100% treatable.
So scars and marks are not always 100%
Yeah.
treatable. So it's always important to go and check with your doctor. And especially, it's a painful scenario too. I mean, when the acne grows, gets into other levels, other stages, they become really painful. So A, it's impacting your appearance. B, it's impacting your mental health. C, it's also you are in a painful state. So it's always good to get it treated because treatment options are there. But doctor, coming to that part, when a patient comes to you with acne, are there tests that you normally recommend for proper diagnosis or trying to know the root cause, or just by clinical investigation, taking history, etc., you're sure why it's happening?
So, see, history taking is one of the most important things during a consultation, especially for acne. So, a lot of things we can determine just from history, and we don't need to do tests. But if we need, we can do a hormone panel to check if they have PCOD or any underlying hormonal disorders or any nutritional deficiencies. If not needed, we don't every time do a blood report, and we can depend on the history. But yeah, I do try to determine the root cause first and then treat the acne accordingly.
Right. And what are the various treatment options available for acne, doctor?
So the from mild acne, we can start with topical creams like benzyl peroxide, salicylic acid, retinoids. We can start with that. Then, if there is moderate acne, we can start oral along with topical, like doxycycline tablets or azithromycin tablets. Then, if it's nodulocystic, like highest level and too much acne on the face, then we can start oral isotretinoin along with topical options. And I would suggest can go for chemical peels like salicylic acid based peels as well.
Okay. So, in scars, these medication works or just the procedures that can work in case of scars and marks, doctor?
So scars and marks are two different things. Acne marks are dark spots which are left after acne due to pigmentation. So
Hmm.
those we can do by some topical skin lightening creams or some chemical peels to remove that pigmentation or reduce that pigmentation, or they can
Hmm.
be helped by creams also if they are not too stubborn. But acne scars, they are the pits which form due to the acne. They
Hmm.
cannot be treated by any kind of topical creams, and if anyone is telling that, they are quacks. They don't know what they're talking about, because acne scars always need some procedure, then only they will get better. They will not be gone completely, but we can improve it up to 60-70%.
Right. So, A, we need to prevent these scars and marks formation.
Yeah.
For that, we need to go and check with our doctor as early as possible and apply sunscreen on a regular routine basis so the
Yeah.
pigmentation is also taken care of. B, please don't fall for quackery because quackery is rapidly increasing. Then doctor also, these saloons, parlors, they also claim of doing, these procedures. They'll say that we'll do some facial,
Yeah.
which will take care of these scars, or we'll do chemical peeling, etc. How important it is to not fall for these.
It's definitely very important not to fall for this. They have not studied dermatology. They have not studied skin conditions. They have not studied about the skin, about the product, about the formulations of this, and about the pathology and pathophysiology of the disease. They don't know anything. We have spent years and years studying about the skin. So we are the experts, not the salon people. So definitely people should not fall for the quackery and go for a dermat if they value their skin.
That is the most important part. If you value your skin, which you should, please go and consult a qualified dermatologist. Have you seen patients coming to your doctor who has already gone for, such procedures which have gone really
Yeah.
bad, wrong, and then they landed in front of
Yes,
you?
yes. I have gotten multiple patients which have done that. They would have gone for a hydra facial to a salon because it's cheaper there, or they have done some micro needling or something with a dentist because it's cheaper there, or it's nearby to their home or something like that. And they have come with the worst damaged skin ever, like full face with post-inflammatory hyperpigmentation, marks, scars, and they are literally crying and coming that what to do now. So yes, I have gotten those patients.
Right. So, I mean, we can, take lesson from that, and we should understand how important it is. Just like for any other organ, in case we have chest pain and we feel that something is not right with our, heart probably, we won't go to a chemist shop and ask for an over-the-counter medicine, or we won't go to anybody next to us that, just
Exactly.
apply something
Yes.
and feel. We will go to the right person. At least we'll go to a physician, a doctor, then we can go to a cardiologist, but then we'll go through the right path. In case with kidney or anything else, we take it so seriously. But with skin, I think we are so lenient. We feel that it's just the surface area, so we can do a lot of
Exactly.
experiments. It's not. Skin is the largest organ of our body. We need to show some kind of respect to it. Abuse is just not the right thing to do with your skin. So please don't do that. Go to the right person, save your skin, save your health. And skin is the reflector, a mirror of our internal health. So if the skin is not good, it of course means that something is not happening well inside us. So please don't do that. Go to the right person. That's really important. Now, doctor, again with pimples, we often get to hear you must have eaten sweets or dairy products or don't fall for junks, etc. So, is there a relationship of acne and diet, and what we should eat and what we should avoid in case we are acne prone?
Yes, so it is true. There is a relationship between acne and diet. Many studies have shown that certain milk products like milk, cheese, paneer, and sugary things, anything which increases your body sugar, it can cause more acne on your face because they are increasing insulin-like growth factor into your body, which in turn increases certain hormones and sebum production on the face, so it can cause more acne.
Okay. And what we need to include in our diet for a better skin or to fight well with the acne?
So I would recommend antioxidant rich fruits, foods, green leafy vegetables, oranges, something with vitamin C, but more water content also, antioxidant content also. Dry fruits and nuts will be good. Water drinking every day, at least 3 liters to flush out all your toxins is very important.
Right. There's a question by Pankesh's question is, can chest acne be treated the same way as facial acne?
So is chest acne can be treated in the same way, but still it depends on the severity of your acne. So you should visit a dermatologist, let them determine the grade of your acne and let them treat it. If you just need topical creams, or if you need along with creams you need oral medications, or along with that you need peels, let your dermat decide.
Right. Whenever we talk about acne, we feel that it's just the women's or girls who have acne, but the fact remains that even men get acne. This
Yeah, yeah.
question was from a male person only. So how? Because they also have, beard, mustache, body hairs, etc., which can make the condition even more worse. So, what would you like to suggest to all our viewers who are watching and going through this issue? What should they do properly?
What should I do for? I'm sorry.
What should they do in case they what should they do in case they have acne, and how to take care, because shaving etc can make the condition even more worse for them, for males.
Yeah. So, see, I would recommend them to see always visit a dermatologist. That is there. Use a face wash, moisturizer, sunscreen regularly in your skincare routine. Don't use the razors again and again in the same area and with the same blade. Keep on changing your blades. Go to a dermat, get some prescription based treatments for your acne. Have healthy food, have antioxidant rich food, have a lot of water, fruits and vegetables and nuts, and try to avoid whey protein. Many guys, due to workout and gym, they take whey protein. So whey protein can lead to a lot of worsening of skin acne. Not many of them know this, so I would recommend that as well.
Right. So it's again a good point. There are so many questions. One question which Anisha Mehta is asking is there a link between acne and heart disease?
Between acne and heart disease, well, there are certain conditions where it can be, but not in 99% of the cases, so you don't need to be extra worried about those things.
Anyway, stress can lead to
Yeah.
heart disease. So don't stress it out much. In case you have any issue, please go to the concerned doctor.
Yeah.
Feroz is asking, can my laptop cause acne? And I would like to add to that, doctor, do our phone, mobile phones, pillowcases, I mean, they can also trigger acne?
Yes, they can trigger acne. See, we this things are lying around daily around us, and we are touching it with our hands. Maybe we are eating something and again touching it back. We have applied something on our face and we have put the phone here, and then again we are putting it again. So the bacteria from pillowcases, from mobile phones or laptops can again come back to our face via our hands or via the instrument itself, and they can clog pores. So yes, they can definitely cause acne. So it's always very
Right. So
important to keep your phone sanitized, your laptop sanitized and clean, and change your pillow covers once in every week at least.
Right. Those who have acne, they feel it's very difficult to keep their fingers away from their face. You know, they'll keep on touching their face, their acne. Many a times we love popping it up, squeezing the acne. We feel that this is the best way to dry it out quickly. And we know for a fact that these are not good practices. How to maintain, I mean, how to resist from doing that, doctor? So we are talking about acne management and also trying to understand how important it is to take care of our skin. And of course, the minimum it is in terms of skincare regimen, the more practical and more effective it is. So in case you are acne prone, stick to a very minimalistic basic skincare routine of a cleanser, moisturizer, sunscreen, but be very consistent with it. Your product should be of proper things. The ingredients should be correct. And in case of doubt, please go and consult your doctor, a qualified dermat. They'll help you in choosing the right kind of products. So it's important that we choose the right thing. And of course, in case you have acne vulgaries, you are a teenager, young adolescents, then again you need to go and consult a doctor so that they can treat your acne in time and also saves you from having those scars and pits. Because many a times acne will leave eventually, but then those scars and pits are forever, ever and ever. Even the treatment, with procedures, it becomes quite difficult to take care of it completely. So in case you want a flawless skin, spotless skin, please consult a qualified dermatologist who has done MBBS MD in dermatology. So this is one thing that you need to do. So today we are talking about skin care in terms of acne management, and I think we have spoken mostly about all the topics, covered all the topics. With some technical issue, I think Dr. Bansari, we have lost her with connection, but still we have almost covered everything and answered all the questions that were asked by our viewers. So thank you very much for joining us, audience, and have a great evening ahead, and take care of yourself, take care of your skin, and stay happy always. Thank you. Goodbye.